A group of doctors did not mince words on Parliament Hill Monday, saying many current Public Health Agency of Canada guidelines for cancer screening are out of date and putting patients at risk.
Much of this death and suffering could have been avoided if Canadian screening guidelines had been based on modern scientific evidence.
The agency has a designated task force that helps develop health guidelines, but these experts say it's time for a much-needed update. The advocates are part of a group called the Coalition for Responsible Healthcare Guidelines. Dr. Fred Saad is the director of prostate cancer research at the Montreal Cancer Institute.
Task force recommendation against screening is outdated, overly simplistic, and goes against all other guidelines that encourage shared decision-making with patients. This has led to an increase in patients presenting with advanced, incurable stages of the disease.
Dr. Paul Wheatley-Price says provinces are taking matters into their own hands.
British Columbia was the first to initiate a lung cancer screening program. Ontario now has a program. Nova Scotia has just announced. Alberta, Quebec, other provinces are in the process. So they've really seen these guidelines as essentially not fit for purpose.
In an emailed response to Global News, the task force says it applies international best practices for evidence review and guideline development used by guideline panels around the world. For each guideline, we rely on subject matter experts and patient partners. And that guidelines published by the task force consistently receive top quality ratings by international organizations. The Public Health Task Force is currently reviewing guidelines for breast cancer screening. That update is expected to be released in the coming weeks. Katherine Ward, Global News, Toronto.